You'll be telling, right? Yeah. Okay.
Hi, this is Rohan Poddar. I'm a visual storyteller to social good brands, and I run a blog called Creatively Unsettled. It's a place for ideas, insights, and storytelling for the newest social entrepreneurship. Today, I have with me Sujay Santra. He's the founder and CEO of iKure. It's a social enterprise that delivers primary healthcare to rural population in India. Hi, Sujay, welcome.
Hi.
Hi, Sujay. Thanks for making time. Sujay is based in Kolkata, and he's taking this live chat from Kolkata. So, Sujay, thanks again for making time. Uh, while doing a bit of research for this hangout, I came across some information which kind of says that your journey, or let's say the reason why you started iCure, is actually
Yeah.
due to a personal experience. I would
Yes.
really like to know what that personal experience is.
Yeah. So I was working in IBM and Oracle for close to 12 years. Last in Oracle as a solution architect, and during that time, I belong from West Bengal, and we could see that for any medical emergencies, the patients have to travel all the way down south or Mumbai for any kind of medical treatment because the facilities are not that great in the eastern part. Uh, now. Being a technocrat, being a solution architect, I was doing really well in Oracle. But this sense of doing something for my own people was always, there within me. Like I had one startup way back in 10 years back in Delhi, which was in the e-commerce line in 2001 too. So that I ran for 1.5 years, and that gave me a good experience and insight about the whole entrepreneurship space. But during that time, the whole startup culture was not there, so I could not run it beyond a certain period. But we saw, during my tenure in IBM Oracle, we saw that the technology impact was there in many areas of our life, be it in railways, be it in banks, be it in others, but not much in the healthcare space.
Right.
Most of the technologies in the healthcare, what was happening is like the patient is coming in, the patient registration, billing, and everything happens. And the moment patient leaves the hospital, the patient loses all contacts and communication with the doctors. Uh, so that was always, we could see that if the patient needs any kind of help or suggestions, they were not able to get. And such kind of incident happened with my own father. I was in Bangalore, and my father stays in Kharagpur, my hometown. And after retirement from bank, he was working in bank in a nationalized bank. After retirement, he had some issues with so he came down to Bangalore. We got checked up at the cardiac surgeon, and he suggested some tests, and then he gave some medicines. He went back to Kharagpur, and he asked him to come back after 6 months. During that time, he had some sleep disorders, so he went to a local doctor because he could not get in touch with the cardiac surgeon in Bangalore. And the local doctor gave him some different medicines. So when he came back after 6 months, the said that you have been taking wrong medicines for the past 6 months. So that kind of shook me within, that if this kind of situation is happening for my own people in my family, imagine what is the challenge or what kind of situations is happening for the people, vast majority of the people who are staying in far-flung areas, who do not have access to such kind of facilities or services for even the basic set of communications. So that was the whole origination of iCure, wherein iCure is actually built around the patients in the last mile in the remote areas,
So,
and how we,
Sujay, the problem that
yeah,
this the problem that it denotes is basically wrong diagnosis. In the sense,
yes,
when people like us, we are the upper middle class, the middle class, people like us sometimes get wrong diagnosis. We can imagine the plight of
yeah,
people who are at the bottom of the pyramid, who most
right,
often, because of lack of healthcare infrastructure, don't get right diagnosis and hence not the right cure.
yes, yes, yeah, exactly. The problem, the problem, what we see normally is, especially in the rural areas, rural and remote areas is lack of information the right time. In the rural areas wherein they don't even know the basic information, and if we are able to guide, educate them about the various they can be treated at much early on. For example, some of the insights which I'd like to tell is the rural patients end up paying much more than the urban counterparts for any basic ailments, because they have to travel with their friends, relatives, which costs adds up to the travel costs. They have to get some lodging when they are at the cities. They have to lose on their daily wage and income, so they end up paying much more than the urban counterparts for any kind of medical ailment. And in many cases, due to ignorance, due to due to lack of communication and awareness, when by the time they actually visit the specialists in the hospitals, it's too late. And so the medical cost goes much higher. In many cases, we are not able to save lives. So iCure's aim is how we will be able to tap on the disease early on, so that we can much more focus on preventive and preemptive healthcare. Because in India, the major focus, if we can see that most of the diseases falls within 90% of the cases are in the primary healthcare space. And if we can really target that, we will be able to, not only train the people about the various health, hygiene and other issues, the cost of treatment, the cost of other things can go drastically down.
Right, right. So, how does iCure address this problem at the same time creating a positive social impact?
Yeah, so iCure, when we started in 2010 with our registered office in STEP, IIT Kharagpur, we thought that, let us build on technology, which is our own proprietary technology called WEMS, Wireless Health Incident Monitoring System, which captures the entire flow of the patient from the last mile to the hospital. So it works on a hub and spoke model. Like in the hubs, so typically we take up a block that has maybe a rough population of 100,000 people staying in. And so in the hubs, we have got the various facilities like general practice, medicines, various tests being done, then ECGs, telemedicine, eye, dental. So these are the various basket of services which provide. And then there are spokes. So spokes are, the mobile clinics wherein the mobile medical team goes few days in a week. Like they will be going Mondays morning 9 a.m. to 12 noon, Thursdays morning 9 a.m. to 12 noon, wherein the patients from the community, they would be able to get physical access to the doctors. They will be able to get all the basic medicines, various tests being done. And on the other days, what happens, we have people like whom we call as community health workers. So these community health workers are actually none other than the members picked up from the community, mostly village women in the age range of 20 to 45, 50 years of age. They are being trained by iCure, and they are given smartphone with medic bag. So when they are visiting these households in the rural communities, let's say on Mondays, the doctor has seen 20 or 30 or 40 patients, out of which maybe 5 to 7 patients need some follow-up. So the community health worker can actually visit the patient's home, and they would be able to see how the patient is doing. They will be able to measure the vitals and other things and enter the data on the
So,
smartphone.
community health workers is your the last mile connect,
Yes, yes. They
right?
are our last mile connect, wherein we have developed various solutions that can really help and empower the communities, educate the communities. The job of the community health worker is not only to capture the various vitals and other signs and make it available to the doctors. The job of the community health worker, since that community health worker is actually the member from that community, we educate them that, okay, if you are going to screen a mother, how the mother is doing in case of pregnancy, by measuring height, weight, blood pressure, urine protein and other things. If you see there is another elderly woman or a man who is suffering from this, could be lump in throat or other things, you should automatically guide the members to come and see a doctor, because in many cases they don't see that that's a problem until the time it gets aggravated and it goes beyond control. So these are the various health, hygiene and awareness issues which we educate to these community health workers, who in turn educate the communities.
Right, right, right. So basically, what you're doing is you are using technology on one hand,
Yes,
which is your telemedicine part, and then
yes,
distribution part, or as you said, when you say that it's a delivery of healthcare, the delivery is
right,
taken care by community health workers, which again
yes.
is a way of empowering them.
Exactly. Yes. And towards that, what we have seen is rural healthcare is actually very different from an urban counterpart, meaning that we are entering areas wherein there has been no formal doctors for the last 50, 60 years. I mean, we do not have any data wherein actually there has been no formal doctors. So typically when we try and introduce our formal healthcare delivery into the system, we get into challenges of social, there are various other issues, and which we try to address them in a very multi-fold manner. For example, in case of there is a mother and child care interventions which we do in various places like Karnataka, UP, West Bengal, with various partners. We see that there are very high cases of anemia, and India is a very anemic country in that sense. And most of the cases, the decision maker in the family is not the pregnant mother; it's the mother-in-law, the father-in-law, the husband. So we try to educate the husband and the family, like these are the various nutritions and a diet that needs to be followed. And even we try to sensitize the community. For example, what we have seen is the mothers won't take iron and folic acid thinking that the baby will be dark in color, or they won't take enough meals thinking that they want to avoid C-section delivery because they think that the baby will be growing more and they'll have difficulty in normal delivery. In many cases, they hide the pregnancies in the first trimester, thinking, I mean, because of shyness, not telling the communities, or because of various other issues. And because of that, they miss out on the important vaccinations in the first trimester. This is the various issues which is linked to not only the medicine or the clinical part, it's linked to the social cultural barriers which we deal with.
Right,
And this is how, when we engage with the community, we see the results.
right, right. Sujay, you are a Ashoka Fellow.
Yes.
How did Ashoka Fellowship happen? And now that you're a Ashoka Fellow, how does that help you in your venture?
Yeah, so I became an Ashoka Fellow in 2015 around October. I have been working with various fellows, social entrepreneurs, and one of the some of the Ashoka Fellows they just suggested me that why don't you apply for that and go for that. So I just applied, and then the fellowship happened. So typically, I am on board since formally from January 2016, and in the past 1 year, 1.5 years, the whole experience has been amazing. We have been participating in various meetings, conferences, even reframing journeys wherein we try to see that what we are doing, how we are doing, what kind of impact we are providing in the community. So those kind of various framework sessions also are
Does it
being
help
carried
in
out.
fundraising as well? Is it particularly easy or
Uh, So typically, Ashoka helps us in giving us the contacts, the networks, and telling and spreading the word about our work, which is very important. So in a way, when we get endorsed that yes, we are an Ashoka Fellow, our work or automatically get endorsed that yes, this comes with some authenticity and proof. So the belief in the network and the community increases multifold. And on top of that, last year I was selected as part of Ashoka Globalizer, which identifies high potential social enterprises across the globe, which has the potential to scale. So there were seven social enterprises selected from across the world, in which iKure was one of them. We participated in Eindhoven in Netherlands as part of the Ashoka Globalizer, which was funded by Philips Globalizer. So we got to meet various global partners on health and lighting, and that's how our visibility at the global level also increased multifold.
right, 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 right. Uh, According to you, Sujay, what has been your greatest achievement, if you had it so far, or you still think that there are a lot of things you, of course, you can achieve many things, but is there a particular moment in this whole journey that has been particularly has changed the game for you or has been of immense learning for you? Uh, has that moment been there in last 6 years, 7 years of running iCure?
Yes, there has been many such moments in the last 7 years. Especially, I come from a non-health sector, hardcore techie guy, and doing a healthcare enterprise. So there has been huge amount of learning, and for us, it was everything was a black box. We did not have any information like typically how do we design the model, how do we train health workers. For example, when we thought that we need to train these village women and make them as community health workers, we gave them smartphones. But the first experience I remember is they were like so scared, so nervous to hold the smartphones. The gestures, which is very simple and obvious for us, like the swipes and the pressing of the buttons, seem not so easy for them. And then we try to give them that confidence that yes, you can do that, because for us we had to enable these village women. Otherwise you really can't expect a urban guy to come and work in the field in the rural areas, and they will not be able to have a relation with the communities and things. So that was a little challenging moment. And today, like we did a research with University of Michigan, wherein we tried to see they had to enter around 50 sets of data on vitals and other things on paper, manual paper versus tablet versus smartphone. Initially, the data that they entered on paper was much faster, and today we are happy that the data that they take on the smartphones is much faster, and even some of the health workers can even manage the smartphones better than us. So that was a sense of glory for us that
Right.
we been able to educate and train these village women and make them adopt to technology. So that was one of the greatest moment. Till date, iCure has touched close to 4 million population across 6 states in India. We have treated more than 500,000 patients through iCure services. And in many cases, we see that there are the main bread earner in the family is sick for last so many months, and that pushes the community back to poverty, extreme poverty. And when we are able to identify and help that patient who is bedridden and cure, and now they are able to go back to work, and that gives them the income which they really need. So we are able to bring those patients falling within the mainstream. That is of glory for us.
Right,
That
right,
has been something we have been able to touch upon.
right, right. Sujay, so how does the journey look from here on? What are the big plans? If you can just share some big plans that you have going forward.
Yeah, so the journey forward is today iCure globally is known for its last mile technology innovation and sustainability plan. I am also a big bit ambassador as part of the sustainable development goal. The next decade is moving towards preventive and preemptive healthcare delivery. Not so much the focus will move from a curative to a preventive healthcare delivery, wherein we as individuals and human beings will be able to get a lot of data by ourselves.
Right.
There will be some devices, gadgets which will check how is my BP doing, how is my uric acid, how is my lipid profile, and other data that we will be able to judge by ourselves. So those kind of preventive mechanisms is already in play. And for example, we have partnered with Philips for a model in Myanmar. Then another partnership is happening in East Africa, wherein they are using our technology for supply chain at the last mile in 5 sub-Saharan countries in Africa. So at iCure, we have been able to leverage technology. We have been able to strengthen the community health workers at the last mile, and that is the future. Because for the next 50, 100, or 200 years, we will never be able to bridge that gap of the doctors versus the patients ratio. No matter how many new policies the government introduces, we'll never be able to solve that problem. So the only way going forward is how we can leverage technology, how we can strengthen these community health workers. For example, we have partnered with University of Oxford. We have come up with a cell scope device wherein a mobile phone camera is fitted with a microscopic lens. And using one drop of blood, we will be able to screen whether the patient is suffering from oral cancer or not by doing an image scanning analysis with millions of cells. So those kind of innovations also we are part of. We have worked with working with MIT on frameworks for congenital heart disease, water frameworks, wherein we are trying to see how the water problems is affecting health. So we are trying to bring all such things as a platform where iKure is acting as a platform, as a collaborator, and we are working with top-notch research organizations like MIT, University of Michigan, Oxford, McGill, wherein if we get to some problems, we are just bouncing off to them. They have solutions, and we are able to implement those on the ground. And we are working with various collaborators like Tata Trust, Philips, and others to really scale these models and impact. So for us, the future is we would want to impact more and more lives through our technology at the last mile within India, and also provide our technology globally. So that's the plan.
Wow, that's a very big goal, and I wish you all the best for that goal. And you are doing some really commendable work in health sector. I'm happy that that you could speak to me today. In fact, Sujay, thanks for talking to me, and
Thank
I'll see you
you.
soon.
Yeah. Yeah. Thank
Bye.
you. Bye bye.